Are you tight on your hip flexors and your hip groin area and you don't know how to control it when you're running and you feel like you're unstable? Hi, my name is Annie and welcome to my channel, Annie Pilates Physical Therapist. This is a gentle Pilates program for those with weak hip internal rotators to slowly activate it strong and healthy. So get your mat ready and join me. Okay, my friends, let's start in sitting up position. With your hip internal rotators, it's hard to close in and cross in the inside, but it's important to open it up as well to get the full range of motion. So from this sitting position, we're going to slowly do a butterfly position, keeping your spine straight. As you open your knees, try to strengthen your core and your posture as you inhale and then exhale back center. So this is a nice warm-up for those with tight hip and weak internal rotators. As you open, you place your hand out of the knee to help you go in. And then resist a little bit at end range, squeeze your knees together. As you inhale, open, lean forward to stretch, and then exhale back center. As you get stronger, this will become easier as you can lower it all the way down someday. And it's okay if you can't yet right now. Inhale, and if you have limited knee mobility as well your hip, try not to force it. If this is your first time, be careful to your body, be gentle. 2 more. Inhale, exhale, last one, and back center. Now gently place your knee inward and then the other out. So this is a mermaid position. This helps stretch your internal rotators and then external rotators on the side where you're opening it. And from this position, it's already difficult to sit up straight. You might feel a little bit lopsided, and that's normal. Try your best to center, engaging your core, and gently open your arms out to feel the stability. And then with this, you're going to slowly turn on one side. Feel that stretch on your internal rotators, and then exhale to the outside. Slow and steady. Inhale. Exhale, squeezing your upper back. Try to engage all those muscles. Inhale. Exhale. And we're progressing by placing your hands forward. With your hands tied together, we're going to twist now on one side. So if your problem side is your left, gently lift your knee up off the mat, and you might find it restricted, and that's fine. Try your best to activate that movement and then back center. And then the opposite side. And now this time you're going to lift this one to activate the internal rotators of this side. And then twist again, lifting your knee left and right. So this is a challenge for those with restricted hip mobility. So I'm trying to mobilize it gently. And if you can't keep your hand forward, you can place it on the mat and gently turn. So with the hand support, it will be so much easier. But for those who want to challenge with your hands up, that's a great way to improve the mobility because it's all on your hips instead of your arms. And now with the gentle progression, we're going to lift the back foot. You can hold on to the mat and lift. So you might find it very difficult. You can use your hand to stretch internally. So lift like this. As we progress, you can use your hands up, diagonally place, and lift. And you might find it very restricted and weak. So it's not just tight, it's also weak. As you lift your foot, hold it for 5 seconds. 5, 4, 3, 2, 1. Keeping your spine straight. And if you can't hold on to the mat, push yourself up and help your foot up to stretch the range of motion. And then once you get that stretch, hold it there. Help it. And then let go slow and steady. Again, lift and down. My recommendation is do 10 times. As you get stronger, you can do up to 50 times. It's a small movement that matters. Up and down. And this is usually very difficult with those with hip impingement, almost like a shoulder impingement. For those with shoulder impingement, it's hard to internal and external rotate or reach their back. So for the hip, it's the same way for those who can't internal rotate because the muscles are not activated. lift. But if you have osteoarthritis, be careful, because it's the ball and socket joint that causes the impingement already. But if it's only muscular, this is safe. And up and down. Now we're going to switch it up to the other side. So mermaid position to the other side. I'm not doing the 90-90 flexion because that's much more challenging for beginners. If your knees are bent to 90 and bent 90 at the back, it's a little bit more challenging. But if it's closer, it's so much easier. So from this position, let's warm up by gently lifting your arms out, keeping your posture straight as you slowly turn on one side to mobilize your hip, slow and steady. Exhale out to the side. Inhale. Exhale. Feel the mobility of your hips and your spine. Last one. And exhale. Now we are progressing by placing our hands forward, clasping it together if you want, touching it together, and gently turn one side. I'm turning to the right and then turning to the left, pointing to my knee. So as I turn to the right, I stop on the knee level where it's pointing, and then in the left. Now I'm progressing by turning to the right and gently lifting my top knee up, my right knee, and then the left lift, keeping my core engaged. So I'm not utilizing my back much. Lift to the right. And as I said, you can use your hands for support for those who find one side much more difficult. Okay, my friends, now we're progressing this mobility by lifting the back foot up as I turn this way. So it's much more challenging when I turn to the right to constrict and lift. But if I turn away and lift, it's so much easier. And then my foot up. So you might find one side much more difficult. Lift your foot up. My back foot. And then my top foot. Much more challenging. Back foot, internal rotate. Keep lifting. So I'm turning to the right, lifting my back foot. As I turn to the left, I'm lifting my back foot. So you might find one side turn a little bit more challenging. And let's hold it for 5 seconds. Hold, help with your hand. Turn, rotate. If you can't do this much because of restriction, that's fine. Slowly build it up. Lift and hold it there for 5, 4, 3, 2, 1, and slowly lower it down. Okay, my friends, we're cooling down now. Hands in knees position. And we're gently lifting our knee up, your hip up. Inhale. As you exhale, internal rotate, cross past midline, and then cross out. In and out. As I cross in, hold it there and gently rock back and forth to stretch your internal rotators and activate those muscles. Now switch it up to the other side. Lift your knee, cross, and then out. In, keeping your core engaged. Out. Last one, cross, and gently rock back and forth. Feel that internal rotators of your hip as you mobilize it back and forth. And now we're cooling down by doing a frog stretch with your knees out of the side of the mat, feet together, and slowly lower it down, extending your arm and lowering to stretch your hip adductors as well as your internal rotators. Inhale and exhale. Hold that for 30 seconds is my recommendation. And that's it. I'm hoping you learned a lot about how to activate your hip internal rotators to improve your hip mobility if you're running, skiing, and you had the difficulty making sharp turns. If you love this video and want to learn more about Pilates, yoga, physical therapy, health, and wellness, please subscribe to my channel, ring the bell so you won't miss anything. You can direct message me on my social media or right down below here on my YouTube channel, and I'll try my best to answer each one of you. Until my next video, always remember, be safe, be well, and healthy you. Bye!